So I'd like to welcome all of you education leaders to our simulation equipment showcase.
My name is Joel Summer. I'm with Hacoma. We brought two devices today. We brought our Mayo Spring, which is an upper extremity device used for patients with neurological deficit, maybe a stroke or MS or CP or Parkinson's. And basically what the device does, it unweights the arm to assist against gravity so the patient can move their arm and reveal any remaining function with the help of heavy-duty springs that allow adjust to the weight support that you would want. And all this can be done. You can lock out different joints of the elbow, wrist, supination, pronation. It records the range of motion as you do the task and also lets you know how successful you are at the task. What you can do is you can add another device we have for the hand that takes the patient's hand out of flexor synergy, which is very common for patients with stroke. Chad will show that right there.
So I'm Stephen Hertz from Simulab Corporation, and we're based out of Seattle, Washington. We focus on soft tissue simulation with fat layers and skin layers and bleeding during cutting. And originally we can do a diagnostic peritoneal lavage procedure also. What we've added on here too is an accessory to our Trauma Man that we can add on a surgical abdomen. What this is for is creating an unexpected catastrophic event. Here with our fat layers, our skin layers, we have a peritoneum in here also. So what we have here is our nerve block trainer for anesthesiology. Go in with my needle, I'm going to administer anesthesia close to the nerve bundle so that it halos around. If we get too close, or we actually enter the nerve, it'll beep at us to tell us we're in the wrong area.
My name is Chris Doherty, and I'm with Remedy Simulation Group, and we offer a variety of different task trainers, mostly soft tissue models, injection trainers. They are soft tissue. You can do a few different types of injections with them, including intradermal, intramuscular, subcuticular, and with the big one here, Z-Track. In addition to that, we are just about to launch an IV pad. So we worked with a nurse to develop this product here. So this has a couple pouches included in here. One pouch is to collect IV fluids, so you can connect an IV line here and actually run a drip through it. On the other side here, this is a blood simulation blood pouch, so you can get drawback or simulation flashback through this IV pad.
Hi, I'm Jonathan Cabral. I'm the Vice President of Sales and Marketing with Gamard Scientific. We have over here on my left, Victoria. There are no wires. She is particularly helpful for what we call high-risk, low-frequency births. And it's about realism. It's about students being able to immerse themselves. So we can practice individual skills, team skills, and care and motion. As you see on this screen, Christopher is going to be setting up a case. He's putting stressors on medical staff to test them. All the equipment that the healthcare staff would be using is your own equipment. This is 5-year-old Hal. He can be intubated nasally and orally. His eyes will blink, his eyes will dilate, he can speak. As you can see, you can put up an ECG, he can be defibrillated. You can do a tracheotomy on him. We can hook up some medications, his blood pressure. Really amazing stuff.
I'm Krista Gabello. I'm the Business Development Representative with Bioness.
And I'm Shinobu Ishigami. I'm the Clinical Specialist with Bioness.
We provide clinical and business support for the Bioness products in your community. Upper extremity device that focuses on hand rehabilitation post-neurologic injury. So it provides electrical stimulation to help with gross extension and flexion of a patient's hand. They can work on both therapeutic as well as neuroprosthetic tasks in the clinic, which is intended, again, for patients with central nervous system injury. It provides foot drop stimulation on the lower leg so that the patient can clear their foot safely during the swing phase of gait. And we also have the plus component, which can be worn on the hamstrings.
Everything is programmed by using this programmer, and so when the patient comes in, all we have to do is put in a control unit, and all of their parameters are saved. So we only have to do that once. A hand device, we can trigger it to open at a certain time, to grasp an object so a patient can perform a function and then let their hand relax. And then the leg device is triggered off of a foot sensor. So this is very functional, whereas if you had that box and wires, you would actually have to time it by hand, which is very difficult, and they've found in the past that people just won't use it.
Hi, I'm Paul McDonald from Otisem. We're based in Toronto. We have an office as well in San Antonio, Texas. The skills of learning how to look into an ear and look into an eye are very difficult to obtain and very difficult to retain as well. So our founders developed a system wherein we've got a box that can become either an ear or an eye. There's an instrumented scope that's attached, and if you get a chance to look on screen, once the scope is inside the ear, we're able to see exactly where the student is at relative to the anatomy. So this way the student is learning what's the difference between otitis media, what's the difference between serous otitis media, and in that way they're able to become better diagnosticians as they proceed throughout their medical career.
Hi, my name is Tila. I'm with HeartWorks, and this is our dual system echocardiogram. So with this model, we can do both TEE and TTE. I am looking at a 4-chamber view of the heart. So obviously you can see the 4-chamber, and since it's on a pathology, you can see on the mitral valve that there's a 3-point prolapse right there.
This is John Vermette with BTE. I'm the Vice President of Sales for Domestic Products. Today we brought with us a couple of different things that are used very heavily in the occupational therapy arena. Simulate multiple tasks, everything from very small hand functions to large functional capabilities. Feedback on the computer so that the patient sees how well they're doing. This device over here is robotic, so you see that it's moving on its own. It's designed to work with stroke patients, patients who've had traumatic brain injury, paraplegics, to retrain the neural pathways. Initially, it will control. Right now, it's moving totally on their own. Patient would have their hand in here, and they'd be seated in this chair, and it would be moving them through the range. As they improve, we take some controls off. We make them do part of the motion, and then as they get even better, we take all the controls off, they do the motion, the system grades their motion. How smoothly, how efficiently they can move.
Hi, I'm Ron Tokarski with Laerdal Medical. What we have here today is SimMan 3G. Have eye drainage, nose drainage, ear drainage, mouth drainage. Also, you can see he blinks and his pupils respond to light, so if we shine a light in there, they'll constrict, or take the light away, they'll dilate. Also, you can do a laryngospasm or a pharyngeal obstruction. Pulses, bilateral radial. He has bilateral femoral, bilateral popliteal, and bilateral pedal pulses. The ability to insert a chest tube on either side. He has the ability to do a tension in the thorax, where you can click on the computer, and it will essentially take away your breath sounds, and his chest is rising equally. This side, the affected side, will stop rising. If you have a bilateral tension pneumothorax, then his entire chest will stop rising altogether. You also have the ability to alter the resistance on the lungs if you're just bagging normally and he doesn't have a tension pneumothorax. If I do the CPR, you can look over here, and this little box here will tell the quality of the compressions I did, how many I did a minute, etc. If we had a bag and we're bagging him, also the respirations would show up there too. 9 different lung sounds, 9 different heart sounds, 5 different bowel sounds. And he has the unique ability that I'll show you in a second, that you can have a different sound in each lobe, 5 anteriorly and 6 posteriorly, and a different sound in each chamber of the heart. This is his blood pressure arm over here, where you can take the blood pressure. And this over here is his IV arm, where you can insert fluids. He also comes with several RFID tags. He has an RFID reader in his head, that if I put this up here, it would be on your oxygen, and the mannequin will sense it, and it'll show up, and it'll show up in the log, so that when you're debriefing, you can see what you did at what time. Also, there are several RFID tags with medications on them. So if we give the medication, it'll recognize what the medication is. And there's also a flow meter in the arm, so it'll recognize the amount of volume we've given. So if you wouldn't give enough, then he wouldn't react, or if you would give too much, he would react as an overdose, etc.